okay? Now, we're talking a little bit about who gets psychotic illnesses. You know, if we look at the general population, about 1% of the population will have schizophrenia, about 1% will have bipolar, and a smaller percentage will have some of the other disorders that we talk about. When we talk major depressive disorder, we talk about 10 to 20% of the population is likely affected at some time by a major depressive episode. Now, only a fraction of them have psychotic illnesses, but it is very important to recognize that mental illness is very common in our society. And when we talk about this, such as psychotic disorders, such as schizophrenia, the incidence, that is, who is developing the disorder, as well as the prevalence, if you looked at the whole group, how many people would have this, are pretty much identical throughout the world. We know that there's no racial, no ethnic, no any type of bias. In fact, mental illness cuts across every single line that we know in terms of financial, socioeconomic, cultural. Everyone seems to be affected. So let's talk a little bit more about schizophrenia, because as I mentioned before, it is probably the prototypical illness. We know in schizophrenia that males and females are roughly equal in who develops the disorder, but one thing that's very different is the age. We know that males are generally affected earlier, somewhere in the age of 18 to 25, where females tend to get it a little bit later and actually have two big time periods where they get it. They get it once from around 25 to 35, and then again around menopause, probably in their 40s or early 50s. Overall, 90% of males will develop it before 30 years of age, whereas only a fourth of the females will. We also know that this, like everything else in medicine that we've come across, is an interaction between genes as well as the environment. So just as someone may have a certain hair color, be a certain height, it's imprinted or given down from their genes, but it also means what they've done in their environment. For schizophrenia, we know that it tends to run in families, just as bipolar does, but that doesn't mean it absolutely has to. In fact, if you had two twins, what we call monozygotic, that had the exact same genetic profile and genetic code, only one of the twins, usually 50%, will develop schizophrenia. So we know that it is something in the environment as well that is causing this. It could be a virus that somebody gets, it could be drugs, it could be a variety of different things. It may be young life trauma. It's hard to say, but what is clear is that it's both the genes and environment interacting. Now, when we talk about treatments, here, medications are the mainstay of treatment for psychotic illnesses. That is because it is difficult to rationalize or engage somebody in therapy if they're not able to engage in a conversation or have impairments in their reality testing. Now, antipsychotics are generally very effective in managing the illness, different illnesses, but they cannot reverse or cure all of the illness. All we can do is manage it, much like somebody with diabetes tries to keep their blood sugar under control, or somebody with cholesterol problems tries to eat a healthy diet and often may have to take medications. It's important that if we are dealing with somebody with a psychotic illness, that they're managed by a physician. Now, I've realized that, Skip, you have one more question. Go ahead.
We have a problem with a lot of people are resistant to taking medication, and what happens is in the culture, what we've seen is Tom Cruise's reaction to psychiatry and his statement that people who have mental illness don't need to take any kind of medication. What's your response to that?
Skip, let me tell you, it's just like anything else. I don't know where Tom Cruise got his medical degree. In fact, I'm not sure that he has one. But what I will say is, while he may be a very good actor, he probably needs to keep his beliefs to himself in this regard. In terms of, I would challenge him to come out to any unit that I've worked at and deal with some of these psychotic illnesses and even try to talk to them, because when people are not acting rationally or have impairments in reality testing, it's difficult to get involved with them. In fact, if you look at the Dianetics founder, L. Ron Hubbard, you may want to do a little bit of research and just kind of find out a little bit about him, and that he suffered from mental illness as well, and that's kind of the founder of Scientology. But generally what I say for people that worry that they don't need medications, this is just like diabetes, cancer. Would you tell the person you don't need medications, you don't need treatment? I don't think so. In terms of therapies, medications we talked about are very effective, but we also use them in combination with therapy. So one of the first things that we do is educate family members, because we want them to know what is going on, what is the course going to look like, and are there signs and symptoms that may alert that someone is about to have a worsening of their psychotic illness. Now, the other thing that we do is co-manage any substance abuse problems, because we know that a high percentage of people with psychotic illnesses tend to run into problems with substance abuse. So, management and treatment for therapy focused on their substance abuse is very helpful. Also, rehabilitation services, such as vocational rehab, getting them back to working once they're kind of leveled out. Also, case management, helping them with their finances, helping them secure a home, are all important parts of managing psychotic illnesses. In terms of the course and outcome, what does this mean for the person that has schizophrenia or has a psychotic illness? Well, this means that they're going to have a very grave difficulty with employment. So they may bounce around from job to job. They may also have difficulties with interpersonal relationships, relating to family members, loved ones. They may have difficulty in planning and completing tasks, taking medications, or going to their appointments. They may have difficulty with their hygiene. One of the things that we realize with this illness and the part of the brain that it affects is it gives them difficulty seeing themselves as having an illness or realizing how ill they may actually be. It also has, as we talked about, some cognitive impacts, so they may have difficulty functioning, doing their finances, organizing things around the home. Now, in terms of primary psychotic disorders, we know that they die at a younger age compared to people that don't have these illnesses. And why that is multifactorial. The first being somewhere around 10% of people with schizophrenia or psychotic illnesses end up completing suicide, unfortunately. But we also know that these people, as we talked about, don't recognize themselves as being as ill, and it's very difficult for them to stay on medications for their mental illness or for any other illness, such as diabetes, high cholesterol. We also know that they smoke around 3 times as much as the general population, so around 75 to 80% of people with psychotic illnesses, such as schizophrenia, will become dependent on something like tobacco or nicotine. Now, Joyce, I know you had one other question. Could you bring it to me right now?
Yes, people have asked me before, are people who suffer from mental illness more prone to violence than normal people?
Joyce, this is an outstanding question. And actually there's a bit of truth, but a bit of a myth. People with just something like schizophrenia or bipolar, depression, anything of this nature are not more likely. And it's actually surprising to a lot of people to find that. Just having a psychotic illness by itself does not make you more violent or aggressive than the average population. What we do know, though, is that people that have a psychotic illness as well as have substance abuse are exponentially. So, there's certain risk of having psychotic illness, there's a certain risk of having substance abuse, but if you put the two together, those are the people that are at a higher risk of becoming harmful to themselves or other people. Now, when we're talking about the